All right, thank you so much. Welcome to another episode of the Love, Hope, Lyme podcast. My name is Fred Diamond. Of course, I'm the author of Love, Hope, Lyme, what family members, partners, and friends who love a chronic Lyme survivor need to know. I'm excited today. We're going to be talking with Dr. Korine Kolivras with Virginia Tech, and we'll get to her in a second. I want to let people know, if you're watching this on YouTube, go up, give us a thumbs up, ask a question, leave a comment. Sometimes, Korine, we get dozens of comments, and they're always fun from people around the world. If you're listening to this on Apple Podcasts, please give us a 5-star review. We would greatly appreciate that as well. And once again, my book, like I mentioned, Love, Hope, Lyme, the PDF, Korine, has been available from day one for free. I've given out over 5,000 copies to chronic Lyme survivors around the globe. The book is up on Amazon. Please feel free to get your copy up there. I've also had people who've reached out and have wanted multiple signed copies. So just reach out to me on social media and I'd be happy to get that to you as well. So I'm excited for today's show. Many of our listeners know. I also should say that even though this is a podcast on Lyme disease, this is not a replacement for medical care. If you're struggling with Lyme disease, co-infections, and other challenges, I urge you to please seek proper medical care. All right. So I'm based in Northern Virginia, right outside of Washington, D.C., and the preeminent university in my state is Virginia Tech, which is located about 4 hours away. It's down about 4 hours from Northern Virginia. You know, it's a very important school to me and to a lot of people I know. It's a lot of the young adults who live in Northern Virginia go to Virginia Tech, and many of them get a great education and come back and work in the Northern Virginia area. I also do a podcast on professional sales. And a lot of the young adults who've gone through the Pamplin Business School have gotten jobs up here. But there's also been some amazing research done at Virginia Tech. And Korine, it was really exciting to meet you and to understand what you're doing and the research that you're doing, that you devoted your life to, and that you've published actually in a new book that's available right now. It's available now, right?
It is, yeah.
Appalachian Epidemics, from
Yep.
Smallpox to COVID, and you
Mhm.
published. It's published by the University of Kentucky Press, and you wrote a fascinating chapter, which we're going to be talking about today. So I'm excited because we're going to be talking about the spread of infectious disease, specifically Lyme disease, and a
Mhm.
lot of the work that you've done. And many people who've listened to the show know that there's a common refrain where someone suffers or struggles from Lyme symptoms, and the medical practitioner that they'll go to will say, "We don't have Lyme in blank. We don't have Lyme in North Carolina. We don't
Mhm.
have Lyme in California. We don't have Lyme in Texas, Florida, South Carolina, Kentucky, Pennsylvania, even fill in the blank." And you're doing a lot of amazing work to prove otherwise, which we're going to be talking about today. All right, so introduce yourself, tell us who you are, and then I'm really excited to get into this.
Sure. Yeah, I'm so glad that you reached out. I'm happy to chat with you, and your book is amazing. It's a great resource. So I appreciate having that to look at. Yeah, I'm Dr. Korine Kolivras. You can call me Korine, that's fine. I'm a professor of geography at Virginia Tech, and I'm a health geographer or medical geographer, which means I study why certain diseases are where they are, how they spread from place to place, and what kind of human or environmental factors might be associated with those diseases.
Good. And again, we'll get to the book in a second, which really is great for anyone to read. It's very well written, very concise, and gives a lot of answers. But tell us about yourself. Why did you choose to study the migration of infectious diseases, specifically Lyme?
Right. So, yeah, just starting out, my initial reason for studying the geographic distribution and movement of infectious diseases is just that I found it incredibly fascinating. The movement of diseases is actually driven by the movement of people. So when we see
Mhm.
diseases popping up in new places, it's mainly associated with the movement of people. Also can be associated with the movement of, whatever underlying animal might be involved, but the movement of diseases is actually the movement of other things. And then beyond that, specifically with Lyme disease, it's the most significant vector-borne disease in the U.S., as I'm sure your listeners
Mhm.
know. So other vector-borne diseases in the world are things like malaria or dengue fever, but in the U.S., Lyme disease is our #1 vector-borne disease. So even though the leading causes of death in the US might be chronic diseases, really something like Lyme disease just has significant health problems for the people that are affected. It's a problem in Virginia. It's been over the past few decades, and so that's mainly why I was driven to study Lyme disease.
Yeah, that's absolutely true. And everybody who's listening to the show, again on YouTube or wherever they may be listening to it, they know that all the struggles that they've gone through. And Lyme disease, for listeners who may not know, represents itself as a systemic disease as compared to a symptomatic disease. So there are so many problems that can come from the tick, and of course, the co-infections that come with it as well. And also other tick-borne diseases like alpha-gal, which we may or may not get into.
Mhm.
Um, so unfortunately, Lyme survivors have often heard from medical professionals that Lyme doesn't exist here. So just give us a highlight. What do your studies show otherwise?
Yeah, so the data that I'm using are the reported human cases of Lyme disease. So I'm actually only working with the data that doctors have diagnosed that have been reported to the state. But I know just from basic conversations with people and just from understanding infectious diseases in the first place that the data that I'm looking at, the human cases that are reported, that's that's an edge of Lyme disease, but the real edge of Lyme disease's distribution or range is definitely beyond what my data are showing, because I'm only working with those reported cases. And so anytime a news article pops up about my research, or there's some other kind of publication, I get emails from even students' parents saying, "Oh my gosh, my child was sick for years in Georgia, and the doctors kept saying it's not Lyme, it's not Lyme, it's not here." And it turned out it was Lyme disease, and that student in particular had probably picked it up at a summer camp. So I'm hearing from people that the data that I'm working with, the reported cases, it's not representing the true distribution of Lyme disease.
No, that's a great point. I've heard from so many people where the doctor will say, or the medical practitioner will say, well, we don't have Lyme in, wherever it might be,
Hmm.
but they don't ask the follow-up question, which is, have you been to North Carolina recently? Hey, have you been to obviously anywhere in New England, et cetera? So that's beginning to get better, but it's still a problem, especially for the
Hmm.
people who have those types of symptoms. And you're right, you get them at camp. I've heard many people in Texas who haven't gotten it in Texas per se, but have gotten it on vacation in the Ozarks, for example.
Right.
So there's so much of that going on. So let's give some understanding of why this happens. So you've written about the dramatic spread of Lyme disease in Virginia, and
Mhm.
you've said there are ecological and demographic reasons. Go into detail about what those are.
Yeah. So again, I'm working with human case data in Virginia, so it's just those reported cases. But let's see, it was around 2007, 2008 that we really saw a major increase in Lyme disease in Virginia outside of the heavily populated areas. So Northern Virginia, the Richmond area, we have a lot of people there. So if we see a high number of Lyme disease cases, it's like, well, that's something we need to understand, but we also have a lot of people there. But when Lyme disease popped up in very high numbers outside of the populated areas, it really caused people to take notice and say, something's going on here. There is likely some increase to the distribution of the disease that we need to understand. The previous research that was done up in the Northeast in New York, Connecticut, Massachusetts, those studies showed the importance of land cover. Is the land forested? Is it a farm field? Is it residential? And so on. And so we thought that would be a good starting point. What's the actual landscape look like in places that have high Lyme disease, and then some that, what's it like in areas that don't have Lyme disease as a significant problem? We were also able to pull in then demographic data from the census tract, so population density, income, age, and so on. So that's the those are the data that we were working with. And what we found in our study in Virginia supports the research that was done in the Northeast. And we found that areas where we have small patches of forest that neighbor herbaceous cover. So herbaceous would be like a pasture, a meadow, a farm field, even a lawn. Those areas where there's herbaceous cover next to forest, those are the places that have the highest risk of Lyme disease. And especially it's a small forest patch as opposed to like a large swath of intact forest.
We're doing today's interview in the late spring of 2025. So, in reading some of the studies that you had forwarded to me to get some ideas on this, yeah, it happened X number of years ago. A lot of the research do you still believe there's a continued growth, and help us understand this from an academic perspective, is this continuing to expand and grow? Like we talk about how ticks are now almost discovered almost anywhere. They can attach to a
Mhm.
bird and get flown and
Right.
then repopulate. And of course, they get transmitted. A lot of people know from deer and from mice as well. Give us some of your thoughts on, academically how and why this is growing.
Yeah, so it does appear from the evidence that we're seeing that Lyme disease is expanding its range as opposed to it's just only being identified and reported. So I think it's a combination that Lyme disease is spreading and then eventually providers are picking up on its presence in the area and reporting it. Um, Actually, between our past conversation and this one, I read an article about and what you just mentioned about ticks latching onto birds, and that movement of ticks could possibly be responsible for the relatively rapid spread of Lyme disease. The expansion of its range. So, if we think about the underlying disease reservoir, which is the source for ticks in the first place, where are ticks picking up the bacteria? It's most likely the white-footed mouse, but there are other animals that can serve as that source. They don't have a long range, they're not running down 81 and taking down the interstate and taking the pathogen with them. But birds do have relatively long migratory paths. And so it could be that ticks are being moved with the migration of birds. So that's something that could be responsible. We've also talked about deer. So deer are not an underlying source of infection. The ticks are not picking up the bacterium from deer, but deer do have a relatively large migratory range compared to something like a white-footed mouse. So it could be that deer are moving the ticks, but it does seem pretty likely now with this recent work that birds could be responsible.
Yeah, we've mentioned the documentary called The Quiet Epidemic many
Mhm.
times on the Love Hope Line podcast. And they open up the documentary showing birds in multiple places with ticks attached to them. So I want to go to the book. Again, you wrote the chapter in a new book called Appalachian Epidemics from Smallpox to COVID. Again, it's published by the University of Kentucky Press. And the chapter that you wrote is called The Continued Emergence of Lyme Disease in Appalachia. First of all, it was very well done. So it was a great
Thank
read.
you.
So I'm looking forward to reading the rest of the book. But your chapter was fantastic, and I want to read something specifically that you wrote. You stated about the growth of Lyme disease in the region.
Mhm.
Quote, I present a hypothesis in this chapter that land cover modification linked to economic pressures related to extractive industries may have contributed to the emergence of Lyme in Appalachia, given that extraction is the leading cause of land cover change in the region. Continued emergence may potentially be tied to further resource extraction, including mountaintop removal, mining, and natural gas projects. So, first of all, for people who don't know Appalachia, we have listeners all over the globe. Tell us
Mhm.
exactly, where the geography is that we're talking about here, and then discuss a little bit about what I just read.
Sure, and honestly, this is kind of a controversial topic because how do we define a certain region? And the Appalachian scholars will kind of debate and discuss what the borders of the region are. And here in the South, we refer to it as Appalachia, but up north it's Appalachia. So I'll call it Appalachia, but I'm respecting that there are different pronunciations as well. So generally speaking, broadly speaking, at least, Appalachia follows the chain of the Appalachian or Appalachian Mountains from the Northeast south through northern Georgia. So it's a chain of mountains along the eastern part of the US. And, the more for Appalachian scholars, I would say the core of Appalachia is in the southern part of the US, and that's where there really has been an Appalachian culture and an Appalachian history that is unique compared to the non-mountainous areas surrounding it. So it's a unique cultural area, I would say, within the eastern part of the US. And then, thinking about land cover. So I'm presenting this as a hypothesis. I actually currently have some grad students that are working on this idea of extraction. So Appalachia has a long history of extraction, beginning with the removal of timber. So it was a source of timber, continues to be a source of timber for the country. So we have, in the past, it was clear cut removal. I think the practice is a little more selective cutting in terms of timber removal. We also have mining as a major industry, especially in the past. We had underground mining, which had less of an impact on the surface, but today's surface mining or mountaintop removal mining is getting to be more common, and that does have a significant impact on the surface, on the landscape. We have the removal of vegetation and tree cover so that the coal seams can be accessed. We've also noted that this is an important area for natural gas extraction. So there are pipelines crisscrossing the region of Appalachia. So it's been an area where extraction is common. And so I presented this hypothesis because we can see in the data that Lyme disease has increased across Appalachia, especially in the northern part of the region. It's now spreading into kind of central and southern Appalachia. So we've seen the movement of Lyme disease out of the suburbs of the Northeast, southward toward Virginia, North Carolina, and then westward into Appalachia. And as I was pondering the distribution of Lyme disease, I thought to myself, okay, in the past, our studies have noted that suburbanization seems to be linked to Lyme disease. When we develop the suburbs, we have these small patches of forest, and then we have that kind of interspersed with residences where people might get, exposed to ticks. But if you look across Appalachia, it is not a place of suburbs. We do have some cities that are growing and towns that are expanding, but it is not a place that has experienced considerable suburbanization. But as I mentioned, over time, it has seen a lot of land cover change due to extraction, timber removal, mining, and so on. And so that's why I presented that hypothesis. I think it will be interesting as my students continue their research to see if there is a relationship between Lyme disease and land cover change due to extraction. It's unlikely that Lyme disease spread into Appalachia is due to suburbanization because we see very little suburbanization there. So that's why I presented that hypothesis in the chapter.
Well, that's fascinating. So we'll look forward to following up with you on that. And just for
Yeah, I
people who
would
are
love
listening,
to.
yeah, for people who are listening, the areas you're talking about, I live again right outside of Washington, D.C. We're talking 2 hours away, right? Again, it's like I said, it's 4 hours to Virginia Tech, but to the beautiful Blue Ridge Mountains, it's the entrance to Shenandoah
Yeah.
State Park is only an hour from my house. So, and you're right, one of the ground zeros of Lyme disease was what's called Loudoun County, and which is about 50 minutes outside of Washington, D.C. Typical suburban thing, things being cut, deer, et cetera, mice, et cetera. But we're talking an area where it isn't too far. And you're right, there's not a whole lot of cities being built. And first of all, for people listening too, it's absolutely beautiful. I mean, we're talking it's breathtaking, the area where you are, the drive, from Northern Virginia to Virginia Tech is just a beautiful drive. What can you tell us about your research? You briefly mentioned westward expansion, but further westward expansion and further southern expansion as well.
Right. So at this point, when we look at the map of reported Lyme disease cases, the CDC puts out I think a pretty useful map that to help visualize that. And again, we're only visualizing the diagnosed and reported cases. So there are a lot of people suffering from Lyme disease that are not represented on that map. But what we see is that Lyme disease has expanded to and beyond the western edge of Pennsylvania, so moving into Ohio. And now we're seeing spread into West Virginia, obviously into Virginia, North Carolina even. So we have absolutely seen over the past probably 2 decades that southward expansion of Lyme disease. And we're working to try to understand what might have caused that. Previously, it seemed to be linked to suburbanization, but now it's hard to say because it's moving into areas that are much more rural and less suburban.
Yeah, and just an interesting point that you made up. Again, most of your research or all of your research is done on reported cases, and many people have stated, the 476,000 cases, which was last reported, I believe, in 2019. And a lot of Lyme shows up as something else, like we've mentioned before. And a lot of times it'll take a couple years potentially for it to be properly diagnosed as Lyme disease, even though it might show up as other types of symptoms. Just the last thing on this particular topic, again, you've also considered how we can make a different decision on how we develop land to reduce the risk of Lyme disease. We could either restrict development or support the Lyme disease transmission cycle. Just what are some of your general thoughts on that without going, too deep into it? Because it's a layered question there.
Sure. And it's, it presents this idea where the burden for Lyme disease isn't necessarily on the individual. We're always told these are the things that you should do to prevent Lyme disease. Wear long sleeves when you're hiking, when it's 90 degrees and humid. That's hard to do. So right now, the preventative methods are put on the individual, but in reality, the conditions that are the actions that create the right conditions for Lyme disease are much beyond the individual, and it's how we as a society choose to develop our land. So when we develop land in a way that chunks up forests into these fragments, that creates this urban sprawl environment, that's setting up the right conditions for Lyme disease. So, in part, there are preventative things that individuals can take, but beyond that, really the conditions for Lyme disease are beyond our control. So we could consider, like at the regional planning level, starting to think differently about how we develop our land.
Wow. Yeah, that's a very interesting point, and we could go down a whole bunch of different ways. Again, we're talking here with Dr. Korine Kolivras with Virginia Tech, and just kind of curious. You've been studying this now for how many years?
Oh, about 18.
Yeah, good for you. Thank you very
Thank
much,
you.
by the way, from the entire Lyme community. And there's been a lot of great work done at Virginia Tech over the years from other places within the institution as well. I'm just kind of curious what the main thing is you've taken away from your almost 2 decades worth of study.
Mhm. Well, I think the main thing that I can take away is something that you and your listeners know very well, and that is the human case data that's reported is is almost thought to be the gold standard. And so if someone sees a map that shows where Lyme disease is, it's thought of as the truth, that that's where Lyme disease is, without considering the possibility that maps are only as good as the data that goes into them. I do remember a story when I first moved here. This was a few years after I moved here in 2004. So sometime around 2006 or 2007, I took my dog to the vet just for the regular vet care. And we were talking about Lyme disease, and I said, well, I'm from Pennsylvania, and Lyme disease is a big problem up there. But what about Lyme disease down here in Southwest Virginia? And the vet said, well, the human doctors don't think it's here, but the vets know. We know Lyme disease is here. So something I would love to look into is how we can use veterinary data of Lyme disease to maybe get a sense of, you know, ahead of the rush of human Lyme disease, the reported data for humans, can we get dog Lyme disease data? And can that help us see almost the canary in the coal mine, right? So if we're seeing Lyme disease in dogs, can that kind of tell us that yes, Lyme disease is here in this area? So I guess that is a long way of saying the main thing that I've learned is that we need to look beyond just the reported data when we're talking about diseases.
Wow, that's actually a great point. I've spoken to so many people who, I think there is a vaccine for dogs, and of course,
Yeah,
there's no vaccine as of September 2025 for humans, and
yeah.
there really isn't one on the very near horizon, if you will.
Mhm.
I'm just kind of curious. I got one time for one or two more questions here. What do you hope happens again with all the studying you've done and you've seen proof and you've documented what's actually happened? What do you hope happens in the Lyme world in the coming year, or say?
Well, I mean, I hope a lot of things. I hope that we have a treatment for the people that continue to suffer without treatment. But I would hope we can get ahead of that a little bit and get education out to providers. I think you had suggested in the beginning that we're getting better about asking patients their travel history. That should honestly be one of the first questions a provider asks someone. Where have you traveled to? And it could be I haven't left my town, or it could be I've traveled around the world, but we travel a lot generally, or we're around people who have traveled. And so I think education is so key among providers so that they start considering Lyme disease as a potential diagnosis no matter where we are. And ask about travel history. And even if the person hasn't left the town, still consider Lyme disease as a diagnosis, because we're not going to have cases reported in an area to know that Lyme disease is there until doctors are looking for it to diagnose and report it. So it's like it's the chicken or the egg here. So, my big hope related to data and research is that education gets out there so that we can start diagnosing those cases in places that are outside of the core Lyme disease area.
And once again, I want to thank Dr. Korine Kolivras with Virginia Tech. Again, I'm really glad I discovered you. I can't remember where it was. It was on something on social media that one of your students, and where's he originally from?
He's actually from Nigeria, but he came here to do research on human health and disease. And I said, "Hey, there's this great work that we can do with Lyme disease." And yeah, so he's gathering information on people's knowledge and practices about Lyme disease. And what we're finding, it's not even necessarily a core question, but
Mm.
people are frustrated by the medical community about diagnosis.
Absolutely. Yeah, appreciated his enthusiasm and look
Yeah.
forward to the work that he's doing. So once again, thank you so much. Congratulations for all the great work you've done and being published in this recent book, which I encourage people, if they're interested in the topic, to check out. We'll put the link in the show notes. Any final thoughts? Anything you want to leave us with here, Dr. Korine Kolivras with Virginia Tech?
Yeah, I would love to hear from anyone that has any questions or comments about the research that we're doing. I That's one of the things that drives me, is that hearing from people that are affected, and that if my research can help someone in some little way.
Absolutely. I'm sure that it has, and I'm sure that it will continue to. All right. Once again, my name is Fred Diamond. This is the Love, Hope, Lyme podcast.